And welcome back to Hannity. Health and Human Services Secretary Kathleen Sebelius was back on Capitol Hill today, trying yet again to defend the indefensible Obamacare. And she struggled to answer direct, simple questions. For example, like this one.
Knowing what you know today, you would have started the launch October 1st?
I would have probably done a slower launch, maybe with fewer people, and done some additional beta testing, which is part of what has happened, frankly, in the early months of the launch to identify what problems we had.
A simple yes would have sufficed, but that's not all. Even after the so-called website fix, her math is still fuzzy when it comes to the number of people that are enrolled. Watch this.
Madam Secretary, when Amazon.com records a book sold, they record a book sold based upon someone who's paid for it. So I would ask that when you return, that you give us actually who has purchased plans. Do you understand our frustration with that?
Sir, as you well know, we did not take over the private insurance market. People will purchase
but you are telling
from insurance
but you're telling us that those who just shop are enrolled.
I have told you, sir, who is enrolled.
Okay, that's why we're frustrated, because we just don't get the truth out of you.
Unreal. Now, part of the reason she may be dodging that question is because, as Politico points out today, Sebelius has said in the past that 7 million users, that was a realistic target for the first year. Now, keep in mind, only 365,000 have actually enrolled. And we've also uncovered the most shocking statistic of the day. It comes to us directly from Sebelius's department. Newly released document explicitly states that in Oregon, only 44 people have, quote, selected a plan. Now, guess how much money Obama's dished out to that state to push their disastrous health care law? $300 million. In other words, you, the American taxpayer, pay more than $6 million for each of those 44 enrollees. That's a disgrace. Here with reaction to this and more, Utah Senator Mike Lee. Senator, welcome back. Good to see you.
Thank you, Sean.
All right, first, let's get your reaction to the Ryan Murray budget deal. A lot of conservatives are angry about it. I want to get your reaction.
Yeah, I'm still looking at it, but from what I can see so far, as I look at this, Sean, although I don't envy Paul Ryan's position of having to negotiate with Democrats in the Senate and with the White House when neither the Senate Democrats nor the president appears to have any desire to pass a budget, I see some flaws in the document that they've come up with. What I see is that it doesn't necessarily make government any more efficient. If anything, it just makes government more expensive, and it puts off more spending cuts that need to be made now.
Yeah. All right. So am I suspecting right? You're going to be a no, probably?
Yeah, I can't support this. I will not be able to vote for this.
All right. Let me move on and talk a little bit about Sebelius. One of the things that amazes me we can't get an answer to, a report we did on this program and broke on this program with Peter Schweitzer, as it relates to, did the president meet alone with Kathleen Sebelius? Now, she struggled with that answer today. Have we been able to confirm if they had any meetings since 2010?
Not to my knowledge. Now, look, this is inexcusable. This is absolutely unpardonable, the fact that there was this little oversight going on in the launching of this significant an enterprise in which the government is very ill-equipped to act. I want to emphasize, though, Sean, that this is about so much more than just the website. In many respects, I think this administration would like us to focus more on the website, because the website is the thing that can perhaps most easily be fixed, even though it's apparently very difficult to do. The bigger problems, of course, relate to the fundamental unfairness of this law, the fundamental unworkability of this law. It's what's behind the website that is most troubling. And it's what's behind the website that is causing millions of Americans to lose their health coverage and others to lose their jobs and to have their wages cut and their hours slashed.
All right, so we have a set of promises, or a series of promises the president made. How many millions of Americans do you think ultimately lose the plan that they wanted to keep? Do you have an estimate on that? Do we know at this point? Is it going to be as high as 100 million?
Yeah, so we've got one study out by AEI that suggests that it's about 100 million. We've got a Duke University study that I think estimated somewhere between 82 and 105 million people will lose their health coverage that they currently have, or at least see substantial changes to that coverage between now and sometime next year. So it's an awful lot of people who are going to be left out in the cold, an awful lot of people for whom that promise the president made will prove to be utterly false.
All right, so now we have rate hike shock. We have you lose your plan shock, rate hike shock, lose your doctor shock. Now it's deductible shock. A lot of people finding out they have high deductibles. Now, some of your colleagues that are up for election next year, Mary Landrieu and Jean Shaheen and Mark Udall and others, they're trying to come up with an Obamacare fix to fix the problems with this, or a do-over. Does that have any chance of moving in the Senate, or are they stuck with their votes on this?
I'll tell you what has a great chance of success is if they decide that we need to start over, that we need to suspend this thing, we need to hold time out on this law. Well, that would have a chance of success as far as getting bipartisan support. But of course, they passed this without any bipartisan support, and they're stuck now with what they've got, unfortunately. Now, we did everything we could to try to protect the American people from the harmful effects of this law. But the truth is, Sean, you can't just do some minor corrective surgery on this law and have everything be okay. As you point out, it's not just people losing their health coverage or losing their jobs. It's also people seeing their premiums go way up, seeing their deductibles skyrocket, and a lot of other people who, once they've gotten health insurance, if they can still afford it, are seeing that the treatment that they need and they've come to rely on will no longer be available, and in many cases they won't have access to their doctor.
But these senators are specifically saying that they're having conversations about possibly introducing a package of fixes at the appropriate time. Is that, I mean, they have the majority, so I guess they could do what they want. I can't see it passing in the House. Is there anything that you could foresee that you would support short of repealing the law and replacing it?
Yeah, look, if there is such a fix, I haven't seen it. I can't foresee any scenario in which I could get excited about something that just tinkers with Obamacare around the edges. I don't think you can make this dog hunt. I think you have to repeal it. And I think that now that the law has been funded past the first of the year, our best hope would be to adopt some law that winds it down and transitions us into a completely different system. This one will not work.